Hello people, in this video let us look at the differences between the antrochoanal polyp and the ethmoidal polyp. Basically in nasal polyps you have two types, antrochoanal polyp and ethmoidal polyp. What are nasal polypi? These are non-neoplastic masses that are edematous mucosa, that's it. They are masses of edematous nasal or sinus mucosa. So you have two types here, antrochoanal polyp, which is also called as Killian's polyp. Right, and then you have bilateral ethmoidal polyp. They're saying it's bilateral because it's usually bilateral condition from the ethmoidal sinus, so ethmoidal polyp. Antrochoanal polyp from the maxillary sinus, so it has three lobes. So it has the antral and then the nasal and then the choanal. So it has some three lobes, okay? So remember, antrochoanal polyp. Here you can see the choanal polyp, guys. You can see the polyp here. So what is this? Polyp, it's a choanal polyp on the right side, okay? So basically, what is nasal polyp? If somebody asks, what will you say? It's a non-neoplastic mass. It's just a benign condition. It's a non-neoplastic mass of what? Edematous nasal or sinus mucosa. From the mucosa, it is either from the nasal, from the nase, what am I saying? From the nose or from the sinus, that mucosa. Okay, edematous mucosa. Okay, as simple as that. You can have it growing from the maxillary sinus, so it will be antrochoanal polyp, which is also called as Killian's polyp, or you can have bilateral ethmoidal polypi. Look at the differences between these two. This diagram will kind of summarize it. See, this one is an antrochoanal polyp. It is seen hanging in the oropharynx from behind the soft palate. Okay. Here you can see bilateral ethmoidal polyp. This is growing anteriorly. Okay. What's written here? A polyp protruding from the left nostril in a patient with bilateral ethmoidal polypi. So you can see one is unilateral, one is bilateral. This one is growing backward, this one is going forward. So this one is growing backward, this one is going forward. Okay. So let's look at this. So are you ready, guys? Let's look at the differences between antrochoanal and ethmoidal. See, this one is in children. This one is in adults. This one usually will be unilateral, only on one side. Okay. It will be solitary, unilateral and solitary. Origin is from maxillary sinus near the ostium. Etiology is, it is infectious. Some infection has happened, okay? See, maxillary air sinus is in pink, you can see here. And this will be the ostium, that is the opening of the maxillary sinus, right? So, from this mucosa of this sinus, if it is arising, it is becoming an antrochoanal polyp. Antrum is maxillary sinus, right? So, there will be an antral part, and then there will be a nasal part, and there will be a choanal part. So, antrochoanal polyp, okay? So, where is the ethmoidal sinus? See, ethmoid sinus are here in green, right? So, from here it will grow how? Anteriorly it will grow. From here it will grow anteriorly. So, that will become ethmoidal polyp, okay? And this one will be multiple it will be. And it will be bilateral also, remember this ethmoidal polyp, okay? Okay guys, look at this. So, from where is the origin for antrochoanal polyp? It is the maxillary sinus. It grows backwards to the choana, hang down behind the soft palate. Yes, we can see that in this photo. It is trilobed. It has antral, nasal and choanal parts. The choanal part may protrude through the choana and fill the nasopharynx, obstructing both sides. That is what it looks like here. This, if you remove it, will not recur, it seems. So that's a good thing, right? How will you treat this? Endoscopic sinus surgery. You see the video on FES, okay? Functional endoscopic sinus surgery. Basically, they will make sure that all these sinuses drain properly. That's it. Coming to ethmoidal polyp. It is more in adults, guys. This will be actually not infection. This is more like allergy, okay? Or it can have many other causes. And they will be multiple and bilateral. And they will grow anteriorly. This is arising from where? From ethmoidal sinus, uncinate process, middle turbinate, middle meatus. What is this? It's coming from everywhere on earth. Not just ethmoidal sinus, even middle turbinate, middle meatus, uncinate process also. They grow anteriorly and they're present in nerves, as you can see here. They're usually small and grape-like masses, obviously, right? Because they are multiple. So they can be small and grape-like masses. This problem is they will recur. If you remove, again nicely they'll grow. And how will you treat endoscopic sinus surgery? As simple as that. Always safe for anything. FES surgery. So you have seen this photo. What is this photo here? This is antrochoanal polyp, but it has come off anteriorly. Actually, it should be hanging from the soft palate backwards, right? So no need to confuse with this photo. So in this video, you saw what nasal polypi are, non-neoplastic masses of edematous nasal or sinus mucosa. They can be antrochoanal or Killian's polyp or bilateral ethmoidal polypi. So you can see antrochoanal is more common in children and ethmoidal is more common in adults. Anthrocoinal is because of an infection. This will be mostly allergy or multifactorial. This will be single and unilateral. This will be multiple and bilateral, and they'll be small grape-like, you can remember. This is coming from maxillary sinus. This is coming from ethmoidal sinus, from uncinate process, middle turbinate, middle meatus, etc. And this antrochoanal grows backwards, you can see here, and it will hang down behind the soft palate. This one will grow anteriorly and be present in the nares, as you can see here. This one will be trilobed. It will have an antral part, nasal part, and choanal part. This one will have grape-like masses, okay, small and grape-like masses. This one, if you remove, it won't recur, but this multiple one, bilateral one, it will recur, okay. For both, this treatment is endoscopic sinus surgery, okay. So that's it, guys. So here we are showing you the sinuses. You can see the maxillary sinus in pink, ethmoidal sinus in green, okay. So that's it, guys. In this video, you looked at some basic information on the differences between the two types of nasal polyps. Bye-bye.